Welcome back, friends. This is a case of ventrofixed uterus, and after doing some momental adhesiolysis, because we have to preserve the ovaries and the round ligament, we are going for the window technique. We trace the ureter and look for the impression of the uterine artery. Put a small nick and make a window. Hold and stabilize the window, then give parallel strokes on the both sides of the uterine artery. This is a good case for demonstration as we can see the uterine artery easily, but we never coagulate uterine without seeing the ureter. That now we can see here in yellow, and also see the beautiful relation between uterine and ureter. Now on the opposite side, we repeat all the same steps. Trace the ureter, look for the uterine impression. If you look closely, you can also see the obliterated umbilical artery going up. When you see the ureter first, it is relatively easy to find uterine artery because it will be just next to it. Remember to give parallel strokes only, so it will bleed less. The window technique looks easy and tempting, but in my opinion, it is necessary to learn and master the lateral approach first and then go for this technique. So see you in next video. Bye bye.